Welcome to another episode of season two of Dr. G at the Heart of Healthcare. I have my friend Hakeem Bello, who I met in Chicago at Elevate, and he is the Director of Business Development at Oasis, Hospice and Palliative Care. And we're just going to talk about the success of the business and what he's doing over there in Chicago. How are you doing?
I'm doing very well, Doctor. Thanks for having me on your show.
Yeah, welcome, welcome. I'm going to let you introduce yourself because you have a lot going on, but I want to say congratulations to you on opening up the House of Goshen and, the dedication and ribbon cutting, but we're just going to dig right into it and help the community understand, the leadership in hospice care. I want this to be about how we have strong leaders and strong administrators and how that helps us as clinicians serve in the community and do well. So thank you for the work that you do behind the scenes to for the people who, go out in the front lines.
Thank you very much.
Yeah. So tell me about your business, like how you got into hospice care. I know you are work with your wife, so just tell us a little bit about what's going on.
We started 10 years ago. Oasis Hospice and Palliative Care started 10 years ago. And we decided to open House of Goshen, which is one of the four levels of care when it comes to hospice. We're going to go into that later on. So this is the inpatient level of care, which it's a ground up construction, is a new construction, 14-bedroom inpatient unit in Flossmoor, Illinois. So we started 10 years ago, and my wife, she has more experience in hospice than me. She worked for a hospice agency for about 10 years, and my background is restaurant management. I used to be a restaurateur for a Chipotle Mexican Grill, so I was there for 10 years. And 2013, we decided to register Oasis Hospice in Chicago. So that's how the journey started. And a couple of years ago, we decided to open the hospice house, or we decided to start, building the hospice house. Just by the grace of God. Actually, that's a long story. Hopefully, maybe I'll get into that a little bit, but really,
Yeah.
this is a miracle for us to be able to do this. So we're really grateful.
Wonderful, wonderful. Well, we always need good, hospice agencies. I don't know the landscape there in Chicago, but not Chicago, in Illinois, but it's wonderful
Yeah.
that you are, taking your customer service management leadership, all those skills that you have from the restaurant industry and putting that in the hospice care because we do have to deal with that. We have to talk about star ratings and all that stuff is
Definitely.
important. So I think it probably comes in handy for with you, and so yeah, so feel free to get into that. So your background, you said, is do they consider that hospitality, restaurant slash
Restaurant
industries?
management.
Yeah,
Yeah,
yeah.
because I think all my career I've been in the restaurant business. I never went into the hotel, side of business. So it's mostly restaurants that I would say my experience is from.
And
And
your wife,
definitely when it comes to customer service, yes. And my wife, she's more of an administrator, most of her experience. But I think we wanted to she fell in love with hospice. It's a calling for us. It's not something everybody, can just dabble into. Unfortunately, nowadays in the healthcare industry, everybody after COVID, everybody started jumping on, into hospice. And I think for a lot of people is more business, how to make money from hospice. But for us, it's not that. It's more caring and just showing love for people that need the services. But it's a different world out there. Um, but that's not the reason why we went into this.
mhm,
Like I
mhm.
said, it's a calling for us. And once we tasted what this is all about, we decided to do more. And that's what our goal is, that we want to build on this and hopefully have maybe 2 or 3 more hospice houses across Chicago,
Mhm.
and really provide the care patients and their families need when it comes to end of life care.
I would love for you to share more about, how you knew it was a calling, or, your wife, being in the administrative side. And then also how this is so important because a lot of people they may not want to die at home, and definitely not in the
Yes,
hospital, but they can have a home-like environment in an inpatient hospice um, home, like the House of Goshen. So tell us about
yes.
the calling and some of that, if you will.
So it started, I would say, 10 years ago for us. Um, so previously, my wife worked with an agency, a successful agency, and I think after experiencing that, we said, her dream was to have a hospice house. But to have a hospice house, Illinois Department of Public Health says you have to have experience in hospice. So that's how we registered Oasis Hospice in October of 2013. So we got our accreditation June of 2015, and that's how we started the agency. Um, it was really challenging, but by the grace of God, we held on. But the original dream of having a hospice house where you bring, um, it's a place you bring people to have their symptoms managed, but in a home-like setting. Most people, when they are declining and they go to the hospital, they put them in ICU or they send them, back home. And some people will pass away, but I think a lot of families and a lot of patients want, they really want to be at home. So that is what the hospice, house is really about, to where you bring people in, you manage their symptoms. It's not a long-term facility where you bring people to stay long-term. Now they can, but the model is for short-term symptom management, and they go back to wherever they call home. It's a higher level of care. It's like an ICU in the hospital, but for hospice patients, you have to be on hospice to be able to use this facility, and you can also use it for respite. So talking about inpatient unit and respite, those are the 2 levels of care when it comes to hospice. There are 4 levels of care for hospice. So you have the routine level, where we send people to, the agency will go into people's home, wherever they call home, to care for them. And you have continuous care, usually is at a home setting, where if a patient has a symptom that is not managed regularly on a routine level of care, then you send a nurse to sit by their bedside till that symptoms is managed. Then you have respite, which is for caregivers that take care of their loved ones at home. And if they want rest, Medicare will pay, Medicare, Medicaid, or private insurance will pay up to 5 days for the caregiver to go on vacation, run errands, or just refresh. So you can bring that patient into a skilled setting like House of Goshen, or into a nursing home for up to 5 days, and Medicare will pay for it. Then you have the inpatient level of care, which is the House of Goshen as well, and that is for patients that needs their symptom managed at a higher level. So we can do IVs, which we cannot do at a routine level right now. But at the House of Goshen, you can do that. You can give, medication at a higher level to care for the patient. And the families can actually be there with them. They can, stay overnight. So everything was designed with that in mind. We have a nice memorial garden to where they can go out, with a waterfall, to where they can go out and just reflect with their loved ones. So there's a lot of things in this 14-bedroom facility that really caters to the patient and their families. And it sits on a 2.24-acre land in the beautiful village of Flossmoor. So we're so grateful to God for giving us the opportunity to be able to, bring this beautiful 14-bedroom inpatient unit to Flossmoor.
That is so wonderful. A lot of families in the community, they're going to benefit from this. And so I just look forward to seeing the pictures on LinkedIn and just hearing about how
Yes.
how this agency is serving the community. And thank you for reviewing the 4 levels of hospice care, because I never want to miss educating the public on what hospice is and what we do, because most Americans don't know about that.
Definitely.
So
Definitely.
yeah, yeah. So I see. Speaking of you mentioned the fountain. You got some. It's a rainy day out there. So
Yes.
when will you be bringing on your first residents of House of Goshen? Like, how soon will you have people there?
Well, the building is, I would say, 95% complete right now. So we're waiting for Illinois Department of Public Health to come in and certify the building. So once they do that, it's a process. Then we wait for Medicare, um, because we're CHAP accredited. So they need to come out as well to make sure the building is, ready to receive patients. So we're looking, hopefully in June, all the inspection will be completed, and we'll be able to receive our first patient. Actually, we're getting calls already, from hospitals that want to send us referrals. So we're we're trying to just hold on, and we're hiring. But it's going to be a beautiful experience. Our goal is not to have people just come in here to die, because a lot of people are saying, oh, that's where you send people to die. No. Although the negative connotation when it comes to hospice is the dreaded H word, that when people hear hospice, they associate it with, well, you're going to die. We've had patients that they actually gave 2 weeks and they lasted over 2 years. We actually celebrate taking people off hospice.
Mm-hmm.
When somebody has been diagnosed with a terminal disease, they have options depending on the stage of that terminal disease. Sometimes people go in and they say, sorry, you're stage 4. I'll give cancer as an example. And there's really nothing we can do. What options do you have? So I think it all depends. My thing is, anytime somebody's been diagnosed with a terminal disease, you have a choice, a decision to make. What stage is that terminal disease? If it's still something you can pursue aggressive treatment, then that's fine. Go ahead and do that. Everybody wants to live, a long life and healthy life. So go ahead and do that. But when it gets to a point to where they've done everything, you've done the chemo, let's say for cancer, you've done radiation, you've done everything possible, and nothing works, you have to make a decision that, do I want to live the rest of my life in a comfortable state, or in pain, or in restlessness, in just everything that is associated with that disease? And a lot of people still die and they're in pain. What hospice does is a service that we come in, we make sure you're comfortable till whenever that time is. We don't decide when that time is, God does. So we come in to help the patient and the family in making sure that they're comfortable, that we provide the care, the love, because sometimes we can be the only family that patient has. So we come in and we be that family, that support, that compassionate care that they need. That is what hospice is when it comes to that time. And we've seen people graduate from hospice. We've seen people actually feel better because that disease process is slowed down. I'm not saying that is always the case, but we've experienced that, and we celebrate that. We buy them a graduation hat and gown, and we celebrate. We bring
You
balloons
do?
because yes, we do. That is what Oasis does. We celebrate that. Because that is the ultimate goal. I think our goal is not about death, it's about living the best life possible. whatever
Yes.
time that is. We want
Mm-hmm.
to celebrate every time that patients has with the family. So that is why Oasis is different. In Illinois, we have like 165 hospice agencies. What sets us apart is little things like that. I'm sure every agency will say the same, but we know what we do when we receive our referrals and when we start taking care of our patients. They become our own family, and um, that's what we're all about. Is making sure
That's
we provide compassionate, loving
right.
care to our families and the patient.
I love that. And, previously, my team, we joked about, like class of 2023 graduate, and for some people, that's not always good, if they have an end stage Alzheimer's bedbound
Mhm.
patient, octogenarian or someone like that. And then they're like, some people can feel like the rug is pulled out from under them. But we talked about that on another podcast where there are
Mhm.
other services and other ways to support them. We're just going to focus on
Yes.
here, the services that you're providing. So I think that is fantastic. I celebrate with you over here on the West Coast to see this, and
Thank you.
I'm looking forward to see that expansion so that people have the options for when they're facing um, end of life decisions and care, the type of healthcare they like to receive. So before we let our listeners and learners go, do you have any parting words about Oasis Hospice and Palliative Care and House of Goshen?
I think what I'll encourage listeners is don't be. I'm trying to find the right words to say that when faced with life limiting illnesses or when you have to make decisions, I think just get the education that is needed so that you're well informed. Sometimes the doctors and the hospitals, they tell you what they know, and sometimes they don't even tell you everything you need to know when it comes to end of life care. So do your research, go online. If you hear the word hospice, do your research and try and see, go read reviews and see what services they're providing. Everyone should be providing the same service, but as we know, not everyone, you know, has the best, service out there. So just make sure you ask questions. The frequency of the disciplines that are going to be coming in, the nurses, the aides, how many times are they coming in a week, and what is the expectation? So ask as many questions as you can, but you have a choice. Don't let any hospital or anyone just say, here is the agency you have to go with. You can make that decision yourself. And by law, they should be giving you choices. So go look at reviews, look at the ratings, and just make an informed decision before you go with any hospice agency. But hospice is not the end of the world. There's hope, there's life in hospice.
I concur. Well, there is nothing left to say about this. Thank you. I'm going to put a link to the website for Oasis Hospice and
Yes.
Palliative Care. You are the valuable resource today for the folks there in Illinois to learn about what you're doing. And we thank you for all you are doing in healthcare.
Well,
So
thank you very
peace.
much. And they can always call us. They can always call us with any questions. We'll be happy to advise as much as we can, even if they don't go with Oasis, but that's the valuable resource for your listeners and viewers as well, that they can call Oasis Hospice and Palliative Care, and we're here to support and you know advise in any way we can. So thank you very much, Doctor. Really appreciate the opportunity.
All right. And that's the way it should be. We're going to point you in the right direction. So signing out.
Exactly.
Peace.
Thank you. Take care.